Hello, class. Today we're going to be talking about necrotizing fasciitis, also known as flesh-eating bacteria. And the learning goals today are for you to be able to describe the cause of necrotizing fasciitis, describe the symptoms of the disease, understand the methods of diagnosis, and list preventive measures for the disease. So, an introduction. Necrotizing fasciitis is a rare infection that can be described as a condition involving flesh-eating bacteria, and it can lead to death if not treated properly. There are about 600 to 700 cases diagnosed each year in the US, and about 25 to 30% of those cases result in death. Necrotizing fasciitis is commonly caused by group A Streptococcus bacteria called Streptococcus pyogenes, the same bacteria that causes strep throat. So, a brief history of necrotizing fasciitis. So, it is a group of lethal infections characterized by rapidly progressing inflammation and necrosis. And the spectrum of the disease can range from necrosis of the skin to life-threatening infections involving tissue, fascia, and muscle. The first clear description of necrotizing fasciitis was given by Joseph Jones, a surgeon in the Civil War in 1871, and he described it as hospital gangrene in 2,642 soldiers, and it had a mortality rate of 46%. So, what are the symptoms of NF? NF destroys tissues in the skin and muscles, as well as subcutaneous tissues, which are the tissues beneath the skin. And the first symptoms of NF may not be serious. The skin may feel warm and red, and it also develops small red pain bumps. But over time, the affected area spreads rapidly and the pain worsens. And some other symptoms of NF include fatigue, weakness, fever and chills and sweating, nausea, vomiting, dizziness, and infrequent urination. And so at first, at the onset of the infection, the affected area appears red, purple, or blue in color with severe pain and tenderness. But then over time, the redness spreads over the skin and the damage to tissue eventually starts. So the anatomy of the affected area. So it begins by affecting the fascia or the muscle, the muscular tissue, and then spreads to the surface. It's open in the skin and then it's deeper into the flesh. So as we said earlier, Streptococcus pyogenes causes NF. And Streptococcus pyogenes is a beta hemolytic group A Streptococcus, and it is the most pathogenic bacterium in the genus Streptococcus. It is an aerobic gram-positive bacterium that is made up of non-motile, non-sporine cocci. It has a beta hemolytic growth pattern in blood agar, which means it breaks down red blood cells as it grows. And this bacterium is responsible for a wide array of infections like Streptococcus sore throat, pneumonia, septic arthritis, and of course, necrotizing fasciitis. And Streptococcus pyogenes is predominant in temperate areas and peaks in late winter and early spring. And it can be transmitted via respiratory droplets, hand contact with nasal discharge like mucus, and skin contact with infected tissue. And so what is the taxonomy of Streptococcus pyogenes? It belongs to the class Bacilli, the order Lactobacillales, family Streptococci, genus Streptococcus, and species Pyogenes. And so what are the methods of diagnosis for NF? It is very important to diagnose NF as early as possible since this disease is very life-threatening. Many NF patients will have a very high white blood cell count and lower than normal sodium levels. And doctors in hospitals diagnose NF mainly in two ways. One of them is using X-rays, and the other is CT scans and MRIs. In CT scans, the images show inflammatory changes such as gas formation, accumulation of fluid, and collection of pus in the fascia. And then for MRIs, NF can be diagnosed with images that show soft tissue or of a thickening of the fascial tissue, thickening of soft and fascial tissue. X-rays sometimes are poor choices in diagnosing NF because it mostly shows air trapped under the skin, which is present in only a small portion of NF patients. So this slide shows CT scan image and ultrasound image of affected areas. Then the first image is a CT scan image of a thigh affected by NF, and the red circled area shows the fascia producing producing gas, which is a symptom of NF. Then the other image is an image of an ultrasound of an area affected by NF. So who is at risk for contracting necrotizing fasciitis? So people who already have health issues that weaken the immune system, such as cancer or diabetes, are at a greater risk of developing infections caused by group A streptococcus. And other people who are at risk for NF include those who have a chronic heart or lung disease, people who use steroids, people with skin lesions, and people who abuse alcohol or inject drugs. Some preventive measures for necrotizing fasciitis. So far, there is no set in stone way to prevent the disease. However, you can reduce your risk with basic hygiene practices like washing your hands and treating even minor injuries promptly. Changing bandages regularly when they become wet or dirty, and avoiding contaminating your injuries. Another option would be to avoid hot tubs, whirlpools, and swimming pools when you have an injury. And finally, it is very important to go to a doctor or an emergency room immediately you suspect the possibility of an NF infection, because treating the infection early is very important to avoid complications.